Welcome back to Gateway's Lifeline for Lifetime. I'm your host, Joanne Sheehan. Today I'm joined by two experienced and compassionate professionals who play a vital role in supporting families through our healthcare coordination program, Gloria Fulmer and Alyssa Gentry. Gloria has over 40 years of experience in education and social program administration. She has supported individuals across all ages with health challenges, disabilities, and learning needs, both in Missouri and New Hampshire. For the past 5 years, Gloria has focused specifically on working with families navigating chronic health conditions. She also holds 2 master's degrees, one in social sciences and another in childhood education. Alyssa has spent the past 11 years in the disability services field and has served as a service coordinator for healthcare coordination for the last 4 years. She finds meaning in building trust and strong relationships with the families she supports and is passionate about helping them connect to one another for mutual support. Alyssa lives in Manchester with her husband and 2 young daughters. For those tuning in for the first time, Gateways Community Services is a nonprofit that has been serving the greater Nashua area for 40 years. We support more than 2,800 individuals with developmental disabilities, children with developmental delays and autism, and aging adults. Healthcare coordination, formerly known as Partners in Health, is a program that supports families with children who have chronic health conditions. So let's dive into what those services look like and how they impact families every day. Gloria, we'll start with you. When a family first connects with healthcare coordination program, what kinds of chronic health conditions do we typically support?
A chronic health condition is one that is expected to last more than a year and typically requires more frequent medical visits and affects the individual both with their family, their social life, educational life. Examples of diagnoses that we support are like diabetes, cystic fibrosis, Crohn's disease, children with cancer, those types of health conditions.
Okay. And what service is Gateways providing for families and individuals through healthcare coordination?
Well, through their healthcare coordinator, it varies dependent upon family needs. It might be assistance in accessing the healthcare they need or perhaps are looking for, applications for services that they may require, such as Medicaid or WIC or SNAP. It could be connections to other social service agencies or resources, solutions for situations, or funding related to their healthcare needs.
How does a child typically become eligible for this service?
So this program is run by the Bureau for Family-Centered Services in New Hampshire, and so it's a statewide program. A family that thinks their child might qualify will be referred to the program from a medical professional, maybe a school, maybe they can refer themselves, and they'll apply through the statewide application process, and then the state will verify their diagnosis, and then after that, they'll be accepted into the program.
So once an individual comes to you, Do you meet with the family and do you decide together what services are needed? Do you suggest services that might be available to them? How does that work?
When the state notifies us that a family is eligible for the program, we meet with the family and we complete what we call an assessment, and we go through a set of questions to get to know the individual, the family, anyone else that lives in their home, and that assessment helps us determine what kind of services that they need. We create what we call a care plan so that we're able to target the services that we give to the specific individual.
And do they have goals they need to meet? Like in previous episodes, we've talked about a service agreement plan, and they have goals that they have to set. Are there typical goals that they have to meet?
As part of the care plan, we work with the family to create goals around their needs. Of course, the goals can change at any time, and we just try to use the goals to help guide us in how we work with the family.
Gloria, you had given some examples of types of support. Can you be a little more specific about what maybe an individual may need as far as support?
Sure. Assistance in finding specific medical providers. Let's say that a child may be having some issues with anxiety, and a parent who perhaps hadn't considered looking for a mental health provider may come to us and say, gee, I'd really like to find a therapist for my child. Or they may be unhappy with the medical provider that they currently have, either because maybe the distance, the person changes practices, or they're maybe just not a good fit for the family, and they may be asking, do we have any suggestions, or can we help them research some other people? It could also be that they are just looking for a different direction. We could also connect families with funding sources. We do provide some funding. It's very limited, but we do provide funding for items that may be related to the health conditions, such as copays, hospital bills, over-the-counter medications and supplies, as well as copays for prescription drugs. Also for families who may need more assistance, we may help them apply for a grant or look for a grant. This is especially if a family might need something like a home modification, or they may be looking for, more items that are way beyond our scope of funding.
Okay. That kind of brings me into my next question. Is there a cost for services through this program?
There is no cost for the family.
I guess what I'm getting at, you talked about you have limited resources, but you do help with some. You can help with some things. So I'm guessing that there's a small budget you have each year. I don't know where does it come from, and do you need to do fundraising?
We have funding from the state. It has remained the same since Partners in Health was established, I think 23 years ago. That funding has not increased, so we are definitely working with very, very limited funding, and we depend on donations, we depend on grants, we depend on the generosity of the community to help us to be able to provide for the families that require assistance in funding. We often can't pay for an entire request that a family makes, so we may only be able to fund part of it just due to our limited funding.
Okay. What role do you have within the family and with the individual? Do you work closely with them? Do you have a big caseload, a small caseload?
Right now we have about 70 people in our program, so Gloria and I split the caseload amongst between us. So I don't know if that's a big caseload or a small caseload. It feels like a lot of families to navigate because everyone has different needs. And I think that and when I say every family has different needs, I think that really hits the nail on the head, because there are so many different places that families need assistance. Some families really just want us as a safety net. And some families were at every school meeting. We're at, getting phone calls on Sunday morning at 7 a.m. And most of the families are in the middle where they're leaning on us for support and guidance and helping to access resources. And I think that in a way, the community, it helps us get to know our community better too when we're able to do a friendly handoff to a different agency that can help the family as well.
I'm just thinking, what about, so these individuals have chronic health needs. What about, where does the insurance company come into play? I mean, do most families have private insurance? Do they rely on Medicaid, Medicare? What?
Both. Medicaid, and our children are too young for Medicare, so typically they have, some only have private insurance, some only have Medicaid, and some have both. As a safety net. It still doesn't cover, even with, if you have private insurance and Medicaid, does not cover all of the expenses, because very often your over-the-counter items, supplies are not covered at all. And there are limits to what even is covered through those insurances.
Wow. So it's difficult, for parents to be able to, even with private insurance, to afford some of the items that maybe their children need.
One of the important factors too is some of our children have some very serious chronic health conditions that tend to be rare, or the kind of part of that health condition might be rare. So parents really want to seek out the expert, the specialist that really, hones in on that specialty. And oftentimes they're, not in New Hampshire. Medicaid, private insurances don't often cover out-of-network providers, and when they do, it's very limited.
Yeah.
So parents can end up with a very large copay.
Wow.
And that is definitely something that we strive to help families cover, because it is, beyond everything else, one of the most important factors that we feel in our program.
Wow. So what typically, I know we had discussed this before, but what typically happens to an individual at the age of 18 in this program? There's a tricky scenario that arises when an individual turns 18 and is considered an adult.
Yeah, so that for some of the individuals in our program, they are adults at 18 and they're their own guardians. They're responsible for all their health care. And for some individuals, someone else takes guardianship over them. So I think regardless of what decision is made with guardianship, that's when, actually I'll even back up to age 14 or 15 or so, we begin what we call transition readiness. So every year we work with the family to fill out a survey to talk about what will make them ready to transition to adult health care. So for example, we talk about medication management. Can they take their medication, the right meds at the right time? Are they able to keep track of their appointments? Can they arrange rides to their appointments? Can they communicate well with their healthcare provider the issues that they're having? All the parts that go into managing your own healthcare. And I think sometimes it's working with the individual to gain those skills, gain the confidence, and sometimes it's working with the parents to take a step back from their child because they've been managing their child's healthcare for 18 years. So the survey helps inform our conversations with the family and the individual. If they can't manage their own healthcare, oftentimes they have a guardian. Someone will take guardianship over them. And then we're also working with the parents to help them transition to adult services. So as you might know, once you're 18, usually a pediatrician doesn't want to see you anymore, and you have to transition to an adult healthcare provider. So we can work with the family to find an appropriate person to take over.
Gloria, did you want to add to that?
Well, one of the things we find is, though, when individuals turn 18, graduate from high school, sometimes their confidence level is greater than their ability, especially when it comes to healthcare, because mom has always been in the background. She's always been that safety net. And so oftentimes encourage that individual to sign a release of information so we can still be in touch with the parent. Because we've had situations where this very competent young person goes away to college and in 2 weeks runs out of all of their meds, and mom needs to step in and reorder them for them. So, and to prevent catastrophes like that from happening, because it is a lot to take on. You graduate, you figure you turn 18, you graduate high school, you go to a career, you go to college. That's a lot to take on, and then add on to it a chronic health condition, and it just really can, it's a lot. And so we try to keep that parent involved as much as possible until the individual is obviously competent enough to take care of themselves.
But they still can stay on this program
Yes,
at the age
absolutely.
of 18, right?
Yeah. We have had individuals who are over 18 who have applied for our program and been accepted as individuals.
Okay, I guess that's what I was getting at. You don't just kick them out after that. I don't mean kick them out. But
Yeah.
they don't just get let go.
No, and there are some children, some, I guess, young adults that choose not to reapply after they turn 18 and their mom isn't applying for them. But I think often we see them stay just because they need the support.
So tell me about your family council.
Our family council is made up by family members, parents. We can have individuals 18 and over join as well, and we have in the past. Currently we don't have any, but our family council, so it's made up of parents, and basically they are there to somewhat decide on how we're going to disperse funding. It's more funding limits for different items that we cover, and they also set up our events, because our family council puts on events which allows families to get together and meet other families who have children or individuals themselves who have chronic health conditions. So we try to do at least, I'd say, 5 or 6 activities a year that bring people out there, bring them either outdoors or for entertainment or recreation, just a time that people can get together. And also as families, we try to encourage families to come, because siblings who have someone with a chronic health condition in their family are affected as well. So we want to kind of see, I'm not the only one out here that is dealing with this.
What have been your most successful events that you've held?
Well, we have one coming up at the end of the month, which at the end of June, which will be our Canopy Lake Day.
Oh, fun.
But we do an apple picking every year. That's been very successful. We do the LaBelle Light Show in Derry every year, and that's been very successful. So our successful events, we often repeat, as well as ice skating at the Conway Arena.
Do you have any fundraising during these events or anything like that? Or is it just
We haven't in the past.
Okay, just curious. And then just my last question, Alyssa, you said in your bio that you loved connecting families together. Can you give me an example of this and what relationships have formed?
Yeah, so I'll go back to my very first council meeting, and we're sitting in this little conference room at Canal Street, and Gloria introduced me to the family council members, and one of them, I don't even remember the exact situation, but she said, nobody quite gets what you're going through like another family who's going through a similar situation. And I think for some of our families, there's Gateways as a wonderful organization, but not everyone in healthcare coordination relates to the developmental disability side of the Gateways community. So they don't always feel like they fit in at Gateways events. And I think that woman just spoke so strongly that she had found a place where she belonged, and that was really important to her. So just an example that I can think of, I actually had 2 kids on my caseload who attended the same school, who lived in the same town, obviously, were in the same class and had the same diagnosis. Oh, and obviously I'm not going to disclose that to the other parent, but they saw each other at a healthcare coordination event. They connected. They actually lived 2 streets apart. They were able to provide childcare to the other person's child because they shared a diagnosis. And it was just a really special moment to see that happened naturally. And obviously it might have happened anyway without healthcare coordination, but I like to think that we really facilitated a great friendship. So.
Yeah, that's awesome. Yeah. All right, well, that wraps up this episode of Gateway's Lifeline for a Lifetime. A big thank you to Gloria and Alyssa for sharing their insights and stories. To learn more about healthcare coordination and other services, visit us at www.gatewayscs.org.